that will build capacity of both government and non-governmental systems to cope with emerging biosecurity threats in Africa. And Global Emerging Pathogens Treatment Consortium, GET, was one of the organizations that was set up about 11 years ago, with the main aim of working with both government and non-governmental organizations to build their capacity to cope with emerging biosecurity threats. And over the years, we've grown to become one of the leading biosecurity and One Health-based organization in Africa, understanding clearly the link between human health, animal health, and environmental health, and understanding that man cannot live in isolation of his environment, and a man is only as healthy as the food he eats, the water he drinks, and the environment he lives in. And that is why we are organizing this webinar series today. Our GET webinar series is one of the platforms we've used over the years to build capacity of experts and stakeholders, especially in the area of biosecurity and One Health. And today we are focusing on another very important issue, the issue of climate change. The theme of today's webinar is strengthening climate resilient health systems in Africa. You agree with me that climate change is one of the biggest health challenge we're having in our world today. Like I used to say, climate change is not just an environmental issue. In fact, it's more of an health issue because it affects the quality and quantity of food we eat, it affects the quality and quantity of water we drink, and it destroys our environment, including health infrastructures and health systems. And that is why the issue of climate change, especially in the health system, must be taken very, very serious. Climate change threatens the health gain we've had in recent years in Africa, because most African countries lack the capacity to adapt to such extreme events that are caused by climate change. And that is why we are organizing this webinar today, to see how we can bring together experts to discuss how we need to strengthen health systems in Africa to cope with emerging extreme weather and threats as a result of climate change. And to discuss this issue with us today, we have 4 subject matter experts from different parts of the continent that will be discussing issues on how we can build resilience of the health system in Africa to emerging environmental threats, especially climate change. Before we go to the first speaker, I will lay down the rules that will govern today's webinar, where, like I said, we have 4 speakers that will be speaking with us. Each of the speakers will be speaking for about 20 minutes. And after their presentations, we're going to take 1 or 2 questions and contributions from our participants. Participants, I know our participants will have questions and things they want to ask the speakers. We can just go to the question and answer section of the webinar on the webinar platform and post your questions there. Our participants will be willing, and our speakers will be willing and happy to respond to your questions after their presentations. So without spending more time, I'll go straight to our first speaker. I'm going to introduce her, read her bio for about 2 minutes, and hand over the floor to her to make our presentation. Our first speaker today is Dr. Tatiana Marufo. Dr. Tatiana Marufo is the coordinator of the Health and Environment Program, including Workers' Health, National Institute of Health, Ministry of Health, Maputo, Mozambique. Dr. Tatiana is a physician and environmental health specialist, serving as a program lead for environmental and occupational health in Mozambique's National Institute of Health, where she bridges public health, climate science, and research policy. She has over 16 years experience, and she leads national efforts on climate-sensitive disease surveillance, health vulnerability mapping, and environmental health system strengthening. Dr. Marufo played a key role in conducting Mozambique's first national health vulnerability and adaptation assessment, in shaping the country's climate, environment, and health research agenda. Our leadership also includes coordinating the National Climate Health Platform under the Ministry of Health and sharing the Public Health Emergency Resilience and Adaptation subgroup. She has done a lot of advocacy and expertise. She has expertise to drive forward-looking evidence-based responses to environmental and health challenges in Mozambique, and have worked across different countries in the global south. Doc, we are very happy to have you on our platform today. I'll hand over the platform to you to speak for about 20 minutes. Dr. Marufo, you have the floor, please.
So, good afternoon, everyone, and thank you once again for inviting me for sharing the experience on building climate resilient in the health sector in Mozambique. This will be actually the focus of my presentation in the following minutes. Can you please confirm that you can see my screen on the presentation mode?
Yes, you can, please.
Okay. So I'll go straight to my presentation, and thank you for introducing myself. I'll be presenting on behalf of our group, our Climate, Environment and Health group for the National Public Health Institute in Mozambique, which we call Instituto Nacional de Saúde Moçambique. So in terms of the outline of my presentation, I'll be focused on, first of all, giving a little bit of background and context of climate change in Mozambique, and then focus a little bit on describing what were our milestones in terms of climate and health in our country. And then I'll be presenting how we try to build, or we are trying, still trying to build the climate resilience in the health sector, taking into account the framework of the WHO of the 10 building blocks. And then, of course, presenting the challenge, opportunities, and finally, the national perspectives. So to give a little bit of background, I might say that, start saying that Mozambique is one of the vulnerable countries to the extreme weather events. And even the climate risk index indicates that our country is located on the 5th position in the world. And unfortunately, the geographic location accounts for this vulnerability of Mozambique. Looking at the climate projections, Mozambique will still experience increased temperatures, the late start of the rainy season, and an increase in the frequency of the extreme and intensity of the extreme weather events. Of course, pressing more challenges in the health sector. Giving a little bit of context of our country in terms of climate change, I wanted to present these two pictures here on the left, in which the first one is showing that in terms of the temperature, the variation, the country annual variation average of temperature has been actually upward trend since 1950. And we are facing an anomaly of 1.2 Celsius degrees above the climatological normal if we are looking to from 1981 to 2010. And of course, as a lot of other countries, in 2024, it was the hottest year, even in Mozambique. And it's important to note that the temperature is increasing and increasing year after year. So another thing that I wanted to point out is regarding the extreme weather events. So the number of the extreme weather events historically have been variable along the time in the country, and mainly dominated by droughts, by floods, and tropical cyclones. But only in the past decade, as you can see, I highlighted here in red, we have faced more cyclones than the past 20 years. So saying that there is a shift in terms of the number of cyclones with a significant increase in the past decade. And we are only looking for 1980 to 2024. As you can see here, the number of cyclones that hit the country in this decade. Of course, these extreme weather events and also the increase on the temperature and the anomalies that we are facing implies, again, more pressure to the health system as a whole in the country. So I wanted to also mention in terms of milestones and start to telling a story of what this started, when this started in terms of climate and health in Mozambique. So back in 2017, we thought that it was good to create an awareness of the impacts of the climate change on health, starting from the health sector and then, of course, including the other sectors. That's when we organized our first symposium on the impacts of climate change on health. And at the same time, we used the data that we had at that time in terms of diarrheal diseases and malaria, and we produced a report, and we released this report on the same day that we organized this first symposium. And it was a very important milestone for us because we had the commitment at the high level for both Minister of Health and also Minister of Land and Environment at that time. So another milestone that we have, it's on 2019, in which we released our first scenarios and predictions of the risk of malaria and diarrheal diseases, according to the prediction that we received from the National Meteorology Institute. And we developed some sort of mathematical models to predict in terms of the risk of an outbreak that we will be facing during the rainy season for both malaria and diarrheal diseases. And we had the opportunity also to conduct a lot of training and human capacity activities in terms of climate and health, in terms of WASH, in terms of modeling, climate and modeling, that technicians from the health system had the benefit to attend to different types of training. In 2021, we improved in terms of local evidence in our country because it was the year actually that we released our first vulnerability and adaptation assessment. And at the same time, we were producing our research agenda. So it was a great milestone for us because it dictates in terms of what we produce in terms of vulnerability of the health sector, but also in terms of the aims and the gaps that we had in terms of the evidence that we wanted to generate for the following 10 years. So collating all these aims into a document, which is our research agenda. We had also the opportunity to work in terms of surveillance of the climate-sensitive diseases, namely dengue, chikungunya, that we were working in terms of sentinel sites along the country. And we had the opportunity to strengthen this surveillance that were actually ongoing at that time, but we supported in terms of generating the evidence of the cases that we are seeing within this sentinel site so that we can triangulate that data with climate variables. So in 2023, we organized our second conference on the impacts of climate change. And this one was completely different than the first one, in which we wanted to only create the awareness. In this second conference, we had the opportunity to share a lot of evidence that we were generated within the country, but also learn from different experience international, because we had a lot of national and international attendees and health and professionals that were sharing different thematic areas within this conference of 2 days that we organized in 2023, and it was right before COP28, in which the first health day was organized, and we also attended to this event, so the COP28, and it was the first time that the health sector attended, and we had a representation at the high level by our Vice Minister of Health that attended also to this event. So this year, our milestone, of course, might be the approval of our our HNAP, Health National Adaptation Plan. We are in the process of updating the findings that we had for the first vulnerability and adaptation assessment, and we, of course, are using this evidence to support the adaptation strategies and actions that we are including on our HNAP. And we have, I think in about 2 months, we will be approving this HNAP. And we had also the opportunity to include a lot of activities and action, adaptation actions, and both mitigation actions in our national and sectorial policies. So the health system, the health sector strategic plan, the NDC, and also other plans that the country is currently in the process of updating. So I'm going to also share how we are building this climate resilience, taking into account the framework of the WHO in terms of the building blocks for climate resilience health systems and low carbon. So the first building block, it's the climate transformative leadership and governance. We wanted to highlight here that our country had endorsed the COP28 UAE Declaration on Climate and Health, and we have attended actively the COP28 and COP29, and we are currently in the process of development our national adaptation plan on the climate change. So showing that we are actually in the position of leading a lot of issues, and also with the commitment of our government on the climate and health matters. So the second building block, it's the climate smart workforce. Within the past 7 to 8 years, we had the opportunity to work within our health sector in the response to emergencies, to the tropical cyclones that you have seen that we are facing in the past years, and also the floods. And the health sector has been very active and proactive in the response to emergencies related to the impacts of the climate change. We had also the opportunity to train a lot in different health professions across the country in issues related to risk mapping, to vulnerability, and also risk communication at the provision level. And we have this perfect timing opportunity to include within our the One Health module, which was under revision at that time. We include climate and health classes in this module of a master program of the field epidemiologic and training within our within the academy, which is the major university and public university that we have in Mozambique, Eduardo Mondlane. And we also include the same topics within the public health and medical residency from the public health school of the same university. So this was a perfect opportunity so that we are trying to build this knowledge or create this knowledge within the health sector at the different levels. So in terms of this, the third building block, which is the assessment of climate and health risks and vulnerabilities, as I mentioned, we have conducted this VNA assessment, taking into account our exposure of the time period of 40 years. And we included different variables from the health sector, from demographic variables, from social and also economic. And we combine all these variables using these guidelines from IPCC, and we have come up with this health vulnerability index that we have of the health sector. And unfortunately, the findings indicate that we have a very low adaptive capacity in the health sector, because we lack in terms of well-prepared health professionals. We lack in terms of budget dedicated to response, to prepare, and also to cope with the impacts of the climate change on health. We still have a lot of issues in terms of the social determinants of health, such as, and environmental also, in terms of WASH, and even the access to care and to health facilities in Mozambique. So our adaptive capacity, it's very low. And as you're well aware, it's the only component that we can actually change and put on the investments to change and modify our overall vulnerability of the country. So in terms of the other building block, which is the integrated risk monitoring and early warning system, the health sector created in Mozambique back in 2015, the National Health Observatory, in which one of the areas is the climate, environment, and health. And we, within this observatory, we are contributing to the integrated risks and monitoring, and also in terms of short and long-term early warning system. So actually, how this observatory operates, we receive different types of data, not only data from the health sector, but also surveillance, routine data from the health sector, but also surveillance data. And we use also databases and surveys from the other sectors, for example, from the National Bureau of Statistics, social determinants of health, climatic data, economic data, and also finance data. And all these data are converged to the same platform, which is the National Health Observatory. And within this platform, we had this commitment to perform at least two types of analysis. The first one, it's in terms of trend analysis and monitoring of indicators. And the second one, it's in terms of modeling to map and assess the risk, but also to predict future scenarios. And after we perform this analysis, actually we develop analytical projects, different types of analytical projects. It can be like infographics, bulletins, reports, and summaries, policy briefs. And these are actually the products that we are delivered to the decision-making process. So this is how the observatory operates. And this is how we are contributing to integrate different types of risks using data from different sectors, and to respond to a prioritized issue or problem that we wanted to address within our sector, but taking into account the data and information coming from the different determinant sectors of the health sector. This is to show actually how we work in terms of e-words. As you can see, it's the same framework that we use for the observatory. We combine data from the health sector with the data from the Met office, and we develop some sort of analysis in terms of triangulation analysis using mathematical modeling. And we produce these also the trends and the special charts or plots. And within this eWars platform, we produce not only the trends and the geospatial plots, but also we have this probability of an outbreak that we can show even in the plots. And we can have the sense at what stage we need to act, we need to respond. And this is very useful at the local level because you can develop the analytical products, the bulletins, the seminal reports, so that you can deliver these products to the process of decision making, for planning for an intervention, or anything that can be useful at the local level to the authorities. That was actually the system that we work at the short term, because it can predict an outbreak with at least 8 to 10 weeks in advance. But this one that I'm showing now, it's completely different, because we are working with the National Institute of Meteorology. They are providing us the outlook or the forecast for the rainy season, which is of a time frame of 6 months in Mozambique, starting on October for up to March of the following year. And we are working excuse me, closely with this Met office in order to understand their data and combine with the happy end surveillance data that we have in the health sector through, again, mathematical models that can actually predict an probability of an outbreak of malaria and diarrheal disease. And we are sharing this in terms of risk maps that you can see here, because we started this activity in 2019 on the rainy season 2019-2020, and we are still working up to now with the Met office on producing these scenarios. The good thing is that these risk maps have been delivered to the Minister of Health, and they're using the maps in the process of developing the contingency plans for the following rainy and cyclonic season. So it's important that they're using the evidence to the process of planning and anticipate probability of a risk or potential emergency that we might face on the health sector. And we are calling this early warning system long-term, because we are predicting for 6 months in terms of the risk of an outbreak of climate-sensitive diseases. So the other building block, it's in terms of health and climate research. As I mentioned on our milestones, we work on a climate research, climate environment and health research agenda. And it's for a 10-year period. And we have actually included all the topics that we have in this detailed agenda for climate, environment, and health in the national research agenda for human health. And we have been produced the data and evidence in the past years, mainly in terms of the climate sensitive diseases. So of course, diarrhea, malaria, and emergent diseases are the main evidence that we have been generated in the country with a lot of publications that we have. But we lack a lot other issues, such as respiratory diseases, allergies that may be caused by, of course, increasing of the allergens, or in terms of the quality of the air, poor quality of the air. We lack in terms of non-communicable diseases evidence and relation with air pollution also. In terms of the mental health, we lack a lot of evidence. In terms of all the environmental changes that may impact on health, we still lack a lot of evidence that we actually have prioritized within our research agenda as part of the national research agenda in Mozambique. With the evidence that we already produced, we are well aware that we cannot conduct research only for the diseases. For example, we need actually to integrate in terms of the approach of the diseases that we are developing in the country, because we need to look at the resilience not only of the health infrastructure, but we have to be able to provide information to resilience of the health system as a whole, and while we are able to communicate and anticipate the risk in the health sector. So this is coming from a report that we have been working with the ICAP in Mozambique, and we produced this information while we assessing the impacts of the cyclone Idai in 2019 and also the pandemic. So we combined these two big events and we produced evidence to the health sector, just to show that we have to look in an integrated approach if we wanted to provide evidence to influence in terms of the resilience of the health system. Okay, this slide is only to show that in terms of evidence, we are well aware that not only the diseases as I showed on the first slide, but we also have to look at the programmatic area. We have to look at the health system, thinking about the human resources, thinking about the services that we are providing in terms of the health system. So that's why we are also committed to generate evidence in terms of human resources. So this is a particular publication that we released in terms of the field epidemiology and laboratory training program, and how they respond to impacts related to the cyclones. We also have looked at the maternal and child health after the cyclones in Mozambique, and also how the programs such as HIV can be sustainable in the face of climate threats in Mozambique. So we are thinking in this integrated approach and thinking about different dimensions of the health system. So the other building block, it's the climate resilient and low carbon infrastructure, technologies, and supply chain. We have come up with this, with developing an assessment in terms of an ability adaptation of the health facilities, taking into account the guidelines of the WHO. And we have conducted these assessments at least in 2 provinces out of 11 that we have in Mozambique. And we had the opportunity with this assessment to inform the local health entities in terms of the vulnerability by different types of events, and of course inform in terms of the respective adaptive capacity of that province. Unfortunately, we didn't conduct this activity for the other 9 provinces that we have in Mozambique because of budget and financing issues, but we aim to incorporate this as one of the priorities in our health national adaptation plan so that we can secure some funds to conduct and inform and keep on informing the local level in terms of the vulnerability of their infrastructure and also the adaptive capacity. So in terms of service delivery, there are different types of actions included in the building blocks, such as the emergency preparedness and management, climate-informed programs, and management of environmental determinants of health. So this is one of the components of the building blocks that we felt that we have a large gap in terms of the health system. And we have, of course, through the evidence that we have been generated in the past years, identify the gaps. And of course, with that gaps, we incorporated that in our sectorial plans. So the health system strategic plan, the health national adaptation plan. We are also currently developing the environmental health strategy in the context of climate and health, and we are including all these gaps in all these national and sectoral plans in order to improve the resilience in our health sector in Mozambique. The final building block is the sustainable climate and health financing. We had this opportunity to work with other countries at the region with a proposal for adaptation fund. And we are actually in the process of trying to secure the funds for these countries in the region. And we, since we have already submitted, and we are still in the process of being evaluated so that we can benefit for funds. This is a project, a specific project in which we are going to work on resilience on health system and WASH. And then at the same time, we as a country had the opportunity to work closely with WHO headquarters in a proposal specifically for our country, in which we wanted to build and strengthen the capacity to the implementation of adaptation action and strategies so that we can submit to the Green Climate Fund. We actually think that we can wait a little bit with this proposal that actually had this first evaluation by our national designated authority within the country, and we receive a very good feedback from them. But we think that with our health national adaptation plan approved, we will be in a better position to submit to this application and probably be awarded with this GCF. And we all know that it's a long process to assess these funds, but we wanted to make sure that we have this HNAP approved, and then we can submit, bearing in mind that a lot of activities and actions that we include in our proposal are well aligned with our national adaptation plan. It's well aligned with the national, of course, and sectorial plans. Okay, in the past years, we have developed and conducted all these activities, but of course, we have been facing a lot of challenges. The first challenge that we face is regarding the data. So we rely on the data that already exists. For example, in working within our observatory, so access to data is an issue, how we share the data across different sectors, and the quality also of data. We are lucky because back in 2016, we established an MOU with the National Institute of Meteorology, and we have been working closely with them since then with the issues related to health and climate, because we are developing projects together. We are working in this Outlook cluster for forecasting for the rainy season. We are doing a lot of activities together, and this is a great also a milestone for us in the health sector. So the other challenge, of course, it's regarding the resources in terms of having the appropriate materials, sometimes having a server for the early warning system, having people trained, and of course, having the funds to all to access all these resources and to train also people. So talking about training people, creating the capacity is also a challenge because we need to create capacity not only at the national level, but we need to create capacity at the local level so that people can better address and cope with the issues related to the impacts of climate change. And we have to train not only the health professionals, but also the climate and environmental professionals that are working at the local level. And finally, one major challenge that we have been facing across the years is the sustainability. So we don't need to create new systems within the sector because most of the time these systems, they don't communicate each other, they don't connect each other, and they are not being using at all. So one issue is definitely use the existing systems for monitoring, for surveillance, for communication, and even for information. This is a big challenge for countries such ours, in which we are keep on running according to the financing and according to the donors and according to different types of aims that appears across our activities. So in terms of challenges, it's important that we have to take action at the different levels, at all levels, not only thinking about the health sector, but also the determinant sectors for health, for example, energy, transportation, agriculture, water sector. So we need to work all together in terms of production, the emissions, so taking actions related to mitigation. We need to work on improve our infrastructures and also livelihoods in terms of working specifically on loss, on damage. And finally, we need to work on anticipation of the risk of impact so that we can have like effective actions of adaptation. Of course, we have different types of actions and initiatives that have been run across the continent and the world in terms of viable opportunities, but we need to think of exploring these opportunities. For example, there is this early warning for all initiative that we can work on integrating the health sector and this initiative, that it's a multi-sector initiative to provide warning for hazards and risks related to the extreme weather events and also the climate variability, so that we can have an effective and equitative climate action. We should look at the natural-based solutions so that we can reduce the emissions, and working together with different countries, including also the community level. I think it's wise, and even thinking that we will have different contexts across the same country, across the same continent. So we need to take these actions that are actually local context-wise in terms of adaptation strategies. And finally, I wanted to also present what are our national perspectives as a country. In Mozambique, we aim, of course, to finalize, to approve, and implement our health national adaptation plan. We think that it will be definitely beneficial for the sector to track or even define the metrics of the health co-benefits. We wanted also to incorporate these health metrics in the national process of planning, not only the national adaptation plan, but also the local national adaptation plans and within the process of the NDCs. And finally, we aim to mobilize and access sustainable and climate dedicated funds so that we can take all these different actions of adaptation, of mitigation, of loss and damage, and towards the resilience of our national health system. And I need to acknowledge all the different institutions that we have been working in the past years in terms of climate and health. And thank you everyone for your attention. Muito obrigada.
Thank you very much.
Yeah, thank you very much, Dr. Tatiana, for that very detailed presentation of what you're doing in your country. And I congratulate you on what you're doing in the area of climate change and health. You gave a very detailed presentation, and it shows that Mozambique is really doing a lot of work when it comes to addressing the impact of climate change on health. And the beauty of this webinar is that we have participants from different parts of the world, and I'm sure our participants will have gained one or two things from what you are doing in Mozambique, and hopefully that can be replicated in their countries and maybe their subnationals too. So thank you very much, Dr. Tatiana. Personally, I've learned so much about what you're doing, and I'm also part of the team working on climate change and health, developing health adaptation plans at subnational levels in Nigeria. Your presentation, I've learned a lot from it, which I'm going to adapt some of it to what we're doing in Nigeria. So thank you very much. That was a very detailed presentation, and I'm sure our participants will have learned so much from it. For our participants that have questions and contribution, you can go to the chat box and put your question there. I'm sure Doc will be willing to respond to you immediately. Without wasting much time, we'll go straight to our second speaker today. Our second speaker today is Dr. Philip Swan. I'll read your bio for some minutes, Dr. Swan, and hand over the floor to you for about 20 minutes. Dr. Philip Swan is the Director of Public Health for the Bahamas, where he plays a pivotal role in shaping the nation's health policies and strategic responses. With extensive expertise in epidemiology, healthcare management, and disease prevention, Dr. Swan has dedicated his career to advancing public health standards and ensuring the well-being of Bahamians communities. Throughout his tenure, Dr. Swan has spearheaded key initiatives aimed at strengthening the country's health infrastructure, enhancing preventive care programs, and fostering robust collaborations with both local and international health agencies. Its leadership is defined by a commitment to evidence-based decision-making, transparency, and community engagement, which has been instrumental in addressing emerging health challenges and improving overall health outcomes. Dr. Swan's visionary approach and steadfast dedication continues to inspire health professionals across the region, reinforcing the importance of proactive and resilient public health strategies in building a healthier future for all Bahamians. Thank you very much, Dr. Philip, for joining us on the webinar platform today. I hand over the floor to you to make your presentation for about 20 minutes. Thank you. Dr. Philip, if you can hear me, I cannot hear you. No, I cannot hear you.
Still can't hear me.
Yes, I can hear you now.
All right. So good morning. As I mentioned, I have to kind of speak through this presentation. I have another engagement that kind of conflicts, given the time you'll have taken to this point. So to start off with, basically, I would like to say that you see my screen now, right? So thank you once again for this opportunity to present. Climate change has been a topic of concern since the last century, and times have only borne out that reality that changes forecasted will be experienced during our lifetime and that of our children and grandchildren, not further down the line. It is no longer something in the distant future that we will see. The Bahamas, under the leadership of our Prime Minister Philip Davis, has taken a lead in raising climate change threats awareness globally, especially for the Bahamas, and for similar small island development states who are vulnerable, particularly to the rising sea levels and to increasing intense storms that traverse our islands and to unbearable heat that gets hotter with every passing year. So the Bahamas is a group of 700 coral-based islands and 2,000 rocks and keys, scattered over 100,000 square miles of ocean just to the southeast of the United States and north of Cuba. We have approximately 30 islands, groups, one with communities have been established. And this means that there's a need for us to establish on each of those islands civil governments, education institutionals, and national security forces and social services. With some islands under 200 persons, it can be understood that the level of services are dictated by demand, but there are shipping and seafaring vessels that traverse the rough seas, especially to get stuff to where it needs to go. Moving along to, we spoke about, I think, previous speakers spoke about the threats of climate change, dengue, rats, weather patterns, and the loss associated with it. So we'd like to talk about two things, specifically the impact of climate change on health and the impact of the contribution the health sector makes to climate. And then also must consider activities of concept, spreading the word of potential impact change on physical and mental health and how to build resilience towards same. One second. Dr. Ayatunde, I actually have to leave now. So hopefully you can continue this at a later date. My apologies, but as I mentioned earlier, I had something that is, someone paid my trip to be here, and I need to go to that presentation at this point in time. So my apologies, but I'm willing to present at a later date when there is more time. Thank you.
Thank you very much, Dr. Ashwan. We truly do appreciate your time.
Yeah, well, sorry for participants. Doc asked to leave here as another engagement, but like I said, we have 4 top subject matter experts with us. And without wasting time, I'm going to introduce the next speaker that will give his presentation. The next speaker is Dr. Wataji Tafa Kutani. Dr. Kutani is a health and environment professional officer, World Health Organization country officer, Addis Ababa, Ethiopia. And I'm going to be introducing him for about 2 minutes before I hand over the floor to him. Dr. Watachi Tafa Kutani is the technical officer for climate change and health, including WASH at the WHO in Mozambique, where he works at the intersection of environmental health, climate adaptation, public health system, with over 25 years of experience in water, sanitation, and hygiene in WASH. In climate resilience, disease prevention, he brings practical and policy-level expertise to some of Africa's most pressing health challenges. He has led national frameworks on drinking water safety, coordinated Ethiopia's first health vulnerability and adaptation assessment, and developed strategies now used in Rwanda and Botswana. Dr. Kutane has been a strong advocate for integrating WASH and neglected tropical diseases programs, promoting collaborative action at both national and global levels. Through his leadership in emergency preparedness, policy development, and environmental health strategy, Mr. Kutane continues to advance resilience, evidence-based responses to climate and health threats across Africa. Thank you very much, Dr. Kutane, for joining us today and for contributing to the webinar. I'll now hand over the floor to you to speak for about 20 minutes. Please, you have the floor. If you can hear me, Doc, I can't hear you.
Can you hear me now?
Okay, loud and clear now. Thank you.
Yeah, thank you very much. Good afternoon. Good morning, good afternoon. I'll be very brief on my presentation. I'll follow these outlines of presentation. I've been asked to talk on the innovative strategy and the case study from climate adaptation in the African health sectors. I think my colleagues, Dr. Tetania, who have talked before me, she has touched already a lot of the innovative strategy, how climate, the impact of climate variability in the climate change is being addressed in many countries. Mozambique is one of the country where myself I have had the opportunity to work for very close to 4 years. And then things are going very well. So I'll go directly to my presentation. Why we need innovative strategy in Africa is number one is the highly vulnerability of the African regions to climate change. So as we have seen from Dr. Tetania's presentation, the vulnerability of Mozambique. Mozambique is one of the very highly vulnerable country with increasing this vulnerability. So as you can see, out of the 14 countries in the world with a very high risk, very close to 71% of those are in Africa. You will see the difference. And also even 43% of those with high is also in Africa. And so when you add very high and high, 50% is in the African continent. So we need to address in an innovative way this challenge in Africa. Why Africa is, you can see the compartmental, the component, the hazard, the exposure over here, and the vulnerability also, and then the lack of coping capacity. Dr. Tetania very elegantly addressed the lack of capacity in the country. When we look the number of districts in the country, they lack capacity. So this is where Africa is having a problem. So due to this reason, over the last 2-3 decades, half of the health emergency in Africa where we are.
Dr. Kutane, please.
Yes.
Your slide is static. Maybe you should put in slide mode.
Yeah, it is in slide mode.
Well, static is just on.
Is
on
it
the
in
first
slide
one.
mode? It is in slide mode from here.
I'm not sure it's in slide mode from here.
Yeah, no,
From
no,
my
it's
side,
in slide mode.
But it's static. It's just on the first slide.
No, it's not going.
No, at all.
It's going from my side. It's going.
Oh, it's not.
You
It's
cannot
static
see.
from my side. No, we can see the first slide, but we're not seeing
What about
subsequent.
the other participant? Can you ask?
I'm not sure. I
Hello?
can see our participant. Yes, our participants are writing here that it's static.
But it's from my side. Can you do it from your side if it is statistic from here?
Okay, fantastic. Can the secretariat run Dr. Kutani's slides from the secretariat, please?
I don't know why it is. Let me.
Okay, give us 2 minutes. We're going to run it from our side here. Okay, click that. Yes, we have it on slide mode now. Can you now run it and see if it's moving?
It's moving now.
Yes, it's okay now. You can go on. Thank you.
Okay, so I think I'm on I've already said this slide because why Africa we need innovative strategy. I said this. I've already stated this one, and then I was on this slide because of this high vulnerability, the health emergency we are dealing it in Africa. Almost 56% is due to climate. It's climate related. So it is also on the increasing trend. Over the last 10 years, between 2011 and 2021, it was increased by 25%. So really, we need to address those things. If you look at over the last 13 years in sub-Saharan African country, why this problem, if you look at the malaria, the trend is decreasing, but there is a strong correlation with the climate change. It's still high in some regions, while that is increasing. If you look at cholera and the waterborne, linked to flood and the drought, is the episode is increasing with a strong correlation with the climate change impact. Dengue and arbovirus as an emerging, which my colleagues already mentioned in Mozambique, the dengue fever, related to urban expansion and also climate change, and also the respiratory tract illness or heat, including the heat illness. You will see the trend, the malaria trend is going down, but it is increasing in some. Cholera is, it's a somewhat zigzag. And then you will see the dengue is increasing, and also the respiratory is increasing because of this. And then if we overlay this one with the rainfall and also with the temperature and also with the extreme weather event, you will see all this. And so in general, from this, the temperature is rising in Africa. The rainfall, you will see the rainfall variability here. And also the extreme weather event is become more frequent. And then the environmental degradation is also one of the challenge in Africa, why Africa is vulnerable. So we need there is a need for urgent need of innovative adaptation strategy. When we say innovative, what does it mean? Because we need to go through it, and then we need to address the health impact of climate change due to several interlinkage and escalating challenge. You have seen one is the vulnerability as compared to the other continent, and though we are contributing to the greenhouse gas very little, and then the weak health system, which is what we call the adaptive capacity. Many African countries have under-resourced health systems that are already stretched, and then climate change add a pressure on it, increasing the disease burden, disruption of the healthcare delivery during extreme weather events such as cyclone, flood, and all those. And also mental health is one of the problems due to related to the extreme weather event, particularly due to loss of livelihood, loved ones, property, and all those things. So we need a context-specific solution. The traditional approach cannot work in Africa because of its diverse ecological variability and also socio-economic setting. So we need a climate smart health infrastructure. We need the early warning system, which my colleagues have mentioned, and also we have this in Malawi, in Ethiopia, and different countries. We need also the technology to use the technology to address this. And then not least, but very important, the community-based adaptation integration is very important, including integration to indigenous knowledge. So when we say innovative strategy, what does it mean? So this is a new and a creative and effective approach that help community, system, or sector to adjust to the current and expected impact of climate change. My colleagues, Dr. Tanya was mentioning, they are trying to forecast 6 months ahead about the cyclone because Mozambique is one of the prone to tropical cyclones. So they are trying to do that because of the link over the last 8 years, what they have done with the meteorology. So we need such a kind of innovative strategy. So the health sector, especially in Africa, needs these strategies, innovative strategies, to protect the public health from climate-related risks such as heat waves, floods, drought-prone disease outbreaks, and also we need this innovation to strengthen the resilience of the health system and the community. So the innovative climate adaptation strategy by itself is a forward thinking. It should be a technology-driven, community-led solution that enhance the capacity of the health system to anticipate, prepare for, and respond to the impact of climate variability in the climate change. So it should be a proactive and forward thinking, not reactive. In most cases, in African context, even the global scenario where how they are supporting health emergency is more reactive than proactive. So we need to focus on the climate change adaptation, which really we need to strengthen the resilience and the decarbonization of the health system, including the health facility. We need to promote the co-benefit of climate change mitigation in other sectors and also address a wide range of health impact of climate change on non-communicable disease, communicable disease, mental health, health infrastructure, even the health service delivery interruption. So it should be a forward thinking. So what are the key characteristics? I've already said this one. It should be proactive, data-driven, technology-enabled, and also locally adaptable, tailored to the specific environmental, cultural, and the socio-economic. It should be interdisciplinary. They need to involve health, environment, agriculture, weather, disaster, and other sectors. Again, it should be scalable and sustainable. One of the challenge Dr. Tatania mentioned is the lack of sustainability, and then she really emphasized the need of sustainability and scalability. She said also not at the national level only, we need to extend this to the local level. When we are extending to the local level, one district, the vulnerability of one district is different from the other district. So it's not possible in a climate change resilience health system, thinking in one scenario or thinking one fit for all is not working. Even within the country, different districts, they have a different vulnerability, so they need different approaches. So for that, there is a need for public education to the harm of climate change. And also we need to inform the stakeholders about the climate-related health harms and how those harms will be experienced locally and how they can adapt to it. And then also we need to create the early warning system that help people prepare for climate influence events and use also the research to better understand health harms and effective response. That is why Mozambique developed the 10 years research agenda on health, on climate change and the environment as part of the National Health Research Agenda. So what are the examples of innovative strategy being implemented in the African sector now? For example, there is a climate-informed disease forecasting, predicting outbreak using weather and health data on malaria, dengue, and others. For example, in Kenya, we have that. In Ethiopia also recently. Over the last 7 years, there is ongoing using the epidemiological and the climatological data for malaria, dengue, and yellow fever, recently integrating also cholera. And the other is, this is green health centers in Rwanda. They are trying to solar-powered health facilities to use green energy. And the mobile health teams during cholera outbreak and the cholera alert in Malawi. And then the community-based training adaptation on the flood preparedness in Uganda. And also the One Health approach in the West African on the zoonotic disease surveillance linked to environment, animal, and health. These are one of the examples. I would like to share this case study from Ethiopia. Ethiopia developed the second health national adaptation, which runs from 2024 to 2028, a costed roadmap with a detailed goal. You will see strengthening the resilience of the health system and the strategic objective, which aimed at reducing mortality and morbidity and enhance early warning system and surveillance of climate-related health emergency, strengthening resilience of infrastructure and the service, promote intersectoral collaboration and the community engagement, improving research, monitoring, and evaluation of climate linkage. So the key intervention is the disease surveillance, infrastructure, work on the infrastructure, capacity building, community engagement, and the data integration. This is the meteorological data integration for climate-sensitive disease and the conditions integration to DHIS is ongoing. We have different cases from different countries. For example, in Rwanda, they are focusing on the strong emphasis on the climate health, smart healthcare facility, integration of climate change to health workers training. The national climate and health strategy is also aligned to the Rwandan vision of development 2015. So it's already there, health is there, including the link to climate change. We have different innovative interventions in Tanzania, which is related to the coastal floods, integration of climate data to surveillance system. Again, we have in Kenya different intervention, the early warning system on malaria and the cholera, community health programs in the arid area to address drought-related health risk. In Nigeria, also the focus on urban heat stress and the flood-related disease outbreak, and the use of mobile health unit during extreme weather event is also those innovative strategy. We have also in Senegal, coastal issues, community-based adaptation in fishing village to address waterborne disease, the NGO support on the education of climate health. This is also one of the innovative. Integrated vector management in Benin is one of the case studies. So I'll go to the summary now. When we are saying innovative health adaptation strategy to climate change impact, we need to know the context of the country, the local, and then the vulnerability of the community. So if you look at the vulnerability, which my colleagues has mentioned from Mozambique and what has been done in Ethiopia, currently in many countries like Botswana, in different countries, they are trying to do their vulnerability assessment at district, at provincial level, which is very important to know the country context and the local context. And then they are looking also the multisectoral and the wider and the comprehensive development context. If you remember the Rwanda one, they are aligned with the Rwanda 2015 development plan. So thinking in a project compartment or in a silo for climate change to address health impact is not working. It will vanish when the project run out. So we need innovative financing, including integrating to the existing health financing system and also looking also for the finance from the climate funding mechanism, from the Green Climate Fund, from the Adaptation Fund. Number of countries are trying that. As the WHO also, we are supporting member states to come up with those climate funding and then to harness those funding system. We have the Climate Adaptation Fund and also the African grant. I've already included in the footnote the link on this issue. We need to encourage also public-private partnership for health infrastructure and the innovation. The private partners who are involved in the health infrastructure construction and the building and the renovation, we need to alert and also support them to address the resilience issues in their work. The policy integration is very important. We need to have the Health National Adaptation Plan as part of the national NAPs, my colleagues already mentioned, and also I have shared the Ethiopian example. The countries need to integrate the health component to the national determinant contribution. Currently update 3 is ongoing. The health need to have a specific target and indicators, and to also achieve those targets, they need to indicate the financial. This is one of the innovative way to access the climate fund. So how this is going to be done? So the climate change, if we want to develop innovative strategy, we need to know the country's sensitive factors, such as the demographic, geographic, and the socioeconomic factors. This is what we call the adaptive capacity and also the geographical location. For example, country like Mozambique, they are highly vulnerable because of the geographical location, like Madagascar. So the demography also, the socioeconomy, and then also the natural factors, like also the droughts, floods, heat waves, and the storm. This is happening as a natural course, but exacerbated by the climate change. The frequency is increased now. If you remember in Dr. Tatenia's presentation, she clearly highlighted the frequency and the intensity of the cyclone is increasing in Mozambique as compared before 20 years. So this is exacerbated by the climate change. So what are the adaptive capacity in place? The policy and the intervention, and also the health workforce, the health infrastructure, the health service, and the financing of the health. So these lead to the health impact. Climate does not operate in a silo. It's operating in the sensitivity, with the sensitivity, exposure, and then the adaptive capacity factors. So we'll see now the sensitive climate risks, the vector-borne, waterborne, and also all listed. We list also the health service, because the health service is also affected because of the climate change. So what are the solutions? We need to focus on the 6 building blocks of the health system: the leadership and the governance, the health workforce, the health information system, the product and the technology, health service, and health financing. This is the building blocks where we have the 10 components of the climate change. So with the assumption of securing the financial resource, technical expertise, community engagement, partnership, and the good governance, this is how we need to address as an outcome. So the impact will being reduced, and then the resilience of the health system will be ensured with the outputs you have seen: transformed governance, trained health workforce, climate resilience, healthcare resilience, healthcare infrastructure, enhanced health service and the program, informed and engaged community. This as an output contribute to reduced impact of climate change and then resilience of the health system. As the innovative strategy, we need to have the theory of change. Without theory of change, we cannot implement the resilience. So we need to know the context. Then to address those specific contexts, we need to have the transformative activities, which is, we have already put it here. So then the output and the target, we need to target what we are going to do in a specific context. And then by doing those we are going to ensure the resilience health system. So again, we need to strengthen the resilience of health system through mainstreaming to development program and then disaster risk reduction. We have the sustainable development. We have the disaster risk reduction, which is the Sendai framework with the 7 targets, which is really most of them. For example, target 1 is reduce global disaster mortality, reduce the number of affected people globally, reduce direct economic loss, reduce disaster damage to critical infrastructure and the disruption basic service. Health is one of these targets. So I'm not going to go through all targets because of the time. And we need to look at also in the context of sustainable development. Then, as I said, my colleagues has presented very well the 10 components. I summarized this as a part of the evidence where we have health information system, the vulnerability, the integrated risk monitoring, the health research will come under. We need to have the evidence. We need to empower the leadership and the governance, health workforce training through in-service and the pre-service, resource, then the implementation. So essential medical product and the technology, the service delivery, such as health determinant sector, health service delivery, health emergency, all these come under the implementation. We need to downscale this to the healthcare facility level as an innovative strategy in terms of the health workforce, in terms of the water sanitation, energy, infrastructure, and the technology in the product, including the low carbon through the supply chain here. We need to implement also address in healthcare facility because that is the one serving the community. In conclusion, we know the African vulnerability. Africa is one of the most vulnerable continents to the impact of climate change. You can see the study estimated that climate change will cause more than 100 additional deaths in Africa per year by 2030. So to address this increased burden of infectious disease and others, we need to have solutions. The effect is, here we have already said, we need to strengthen the surveillance and the monitoring system. We need to ensure climate resilience in health infrastructure. We need to invest in innovative research and development. We need to promote behavioral change to mitigate challenges. Addressing immediate implication of climate change is also very important. For this, we need the capacity building. Without capacity building, we cannot do. What you have seen in Mozambique is because of the capacity building through different projects. Now they are managing and the capacity is strengthened and then they moved forward. Then we need coordination also among the multisectoral. There is a need for the partnership and also we need a resource, both in resource and in outside resources. So thank you very much. This is the source document. Thank you for the opportunity and also for giving me the chance to talk and to present. Thank you. Over.
Thank you very much, Mr. Martin. You can stop sharing your slides now. Okay, thank you very much, Mr. Martin, for that enlightening presentation. So right now, you mentioned a few things. You mentioned that Africa is one of the most vulnerable continents to the impact of climate change, and studies has proved this. Then you mentioned a few solutions that we should do to ensure that climate change is mitigated. You mentioned strengthening surveillance and monitoring systems, ensuring climate resilience in healthcare infrastructure, investing in innovative research and development. You also mentioned promoting behavioral change to mitigate challenges. And lastly, you mentioned that addressing immediate implications of climate change is important. So thank you once again. So moving on to the next speaker, we would like to introduce Dr. Charles Michael Ekatsoabi. I apologize if I pronounced that wrongly. So I will read his biography briefly. Dr. Charles Michael is a senior technical officer at the Africa CDC Eastern Africa Regional Coordinating Center, where he leads regional surveillance, One Health, and climate health integration across 14 member states. With over 14 years of experience in veterinary and human public health, he has worked extensively on immunization, outbreak response, and health workforce development. He previously served as Assistant Director in the Federal Ministry of Agriculture and a field coordinator with AFENET, leading Nigeria's measles elimination and health system strengthening efforts. During the COVID-19 pandemic, Dr. Ekatsoabi led the epidemiology and surveillance arm of Nigeria's Presidential Task Force and contributed to national vaccination planning. He holds a Doctor of Veterinary Medicine and Master's degree in Public Health and Disaster Risk Management. His leadership continues to shape coordinated, resilience, and evidence-based public health solutions across Africa, especially in the interface of climate, health, and emergency preparedness. Thank you very much, Mr. Charles Michael, for honoring our invitation. You now have the floor. Dr. Charles, can you hear me?
Thank you very much. I'm sorry, I think I was speaking muted. I don't know if you can hear me now.
Yes, we can. Please go ahead.
And can you see my slides?
Perfectly.
Okay, good afternoon, colleagues. I'm speaking to you from Nairobi, and it's my pleasure to meet with you all on this platform. I'm talking about one of the critical determinants of health, not just in our continent, but globally today. It's also very impressive to talk about it because it is becoming a critical health threat and generally threatens life globally. Many of my colleagues have spoken to this particular discussion and topic. So I'm going to be focusing on the policy to action perspective. And I'll be talking to us about operationalizing the Africa CDC climate change and health strategic frameworks for building resilient health systems, not just locally in countries, but also looking at cross-border coordination, looking at the larger framework of the continent. Thank you for the biography read. So I'll quickly walk you through some of the discussions. I won't overflow this because they've been highlighted by some of our previous speakers, but sorry. Okay, so it's good to note to build on what of the previous speakers have talked about climate change. But this discussion should have happened many years ago, but like they often say, it's better late than never, because climate change is like cancer. When the climate starts changing, when the rate of change increased incrementally as a result of human action, many of us did not take cognizance of it. Just like when cancer starts, we do not know until when it becomes very obvious. But today, we're not just being threatened by climate change, we're experiencing the impact, and it's good that we do something collectively about it. I think some of the data have been read, but one thing that strikes me significantly that I wanted to highlight is that of all the public health events that have occurred in the last 2 decades, looking at 2001 to 2021, 56% of these have been linked to climate change. And I do know that there are epidemiologists and biostatisticians in this discussion. You know, when you have a determinant that have this degree of contribution to the overall public health emergencies and events in a given geography. I think that determinant should be the major focus of all health practitioners. And that is why it is important that all of us put together our efforts to reverse or reduce the impact of climate change, whether by mitigation actions or by adaptation actions. It's good to note that just in 2023 alone, extreme weather events killed greater than 15,000 people, while drought affected more than 88 million people. This was just 2 years back. And like Mr. Kuten did mention in his presentation, this data is worsening every day, and we really need to do something about it. Highlighting specifically infectious diseases in the continent, we see that climate change is exacerbating previously known infectious diseases while also facilitating the occurrence of emergence of new diseases. Most of the outbreaks we have in the continent, which are not only happening within certain geographies, but have become protracted and persistent in heater to free zones. Many of them are linked to climate change as an exacerbating effect. And one of them is malaria. We've seen the burden of malaria increase significantly. In Kenya, for example, where I'm speaking from, we've seen counties which hitherto used to be malaria-free now reporting significant malaria burden because of the shifting scope of the malaria vectors as a result of enhanced climatic conditions for their proliferations. So whether you're looking at malaria or you're looking at dengue fever or you're looking at waterborne diseases such as cholera, many of them are linked to climate change. This is why at Africa CDC, because as an agency, as a continental agency of the African Union, with the mandates of the heads of states and government of the countries that make up this union, our priority is to be able to ensure a healthier, safer, and more prosperous Africa. So you can imagine for us to be able to achieve this, we must also look at something like climate change with the impact of public health events that it is contributing to in the continent. And that is why Africa CDC is prioritizing climate change actions and their inclusion into continental health security initiatives. And to be able to have a coordinated approach to that, we needed to have a strategic framework that defines our priorities and our critical interventions to ameliorating those priorities. This is what the strategic framework is all about. We have many key players, like you've heard from Dr. Tatiana from Mozambique, and you've also heard from Mr. Kuten from WHO. There are many actors playing in this environment. One of the things that we need to be able to enshrine as an institution is that we need to have a sense of coordination so that our individual impacts can collectively make greater expected outcome, so that we don't duplicate rules, but we're able to define rules and then know where the critical gaps are and then be able to bridge them. That is the essence of the strategic framework. The strategic framework was developed over a 1-year period. And of course, you can see the trajectory of that development. It took the input of experts, many experts across multiple agencies, and also took the input of several member states representatives who have worked closely in the climate change sector and understand the context of our continent. And working with them strategically, following a very well-defined process, we were able to have a finalized continental framework that we think speaks to the context of Africa. It is in the spirit of this framework that I'm making this presentation today. Now, in the framework, out of the many areas of vulnerabilities that Africa is exposed to, we did try to prioritize so that we can concentrate, like we have noted, resources are scarce and have alternative uses. So we needed to identify what are the key priority areas, which if we intervene, is going to cause the greatest positive outcome. And using well-defined approaches, we were able to streamline 5 priorities that if we are to collectively work on, we are optimistic that the resilience that is being projected in this webinar will be achieved across various communities and health systems. And the priorities that we've identified are vector-borne and zoonotic diseases, food, nutrition, and insecurity. And we're also looking at heat waves and extreme temperature, among the other ones you're seeing on the screen. Now, to be able to address these, priorities, we had to identify appropriate contextually situated interventions that speaks to our various member states as Africa, knowing fully well that we have a lot of unique differences compared to many other climes where many of the protocols that we sometimes try to adopt are developed. So we wanted something that is not only contextually situated, but is also culturally adaptable and also scientifically beneficial. So we're looking at interventions that collectively will help to mitigate the health impact of climate change by focusing on key resource areas that build resilience across health systems and vulnerable communities in Africa. Now, the overarching aim of these interventions is to be able to mitigate the contributions to climate change, enhance our adaptation, and then ultimately build resilience and better health conditions for our people. The motivation is to be able to combat the growing risks from climate change by strengthening governance and leadership, advancing research, enhancing emergency readiness, strengthening risk communication and community engagement, while facilitating capacity building and innovative financing for a resilient future. Some of these are, and if you see, when Wataji talked about the building block of health system, you will agree with me that all of these strategic pillars actually contributes to the overarching intent of the various segments of the health system. Now, I'm going to just take a short dive into some of the key components of the thematic interventions that we've identified. Why this is necessary is because we are talking of policy to action. What actions do we need to take? Now, the policy discussion is the fact that we need to strengthen leadership and coordination of all interventions at the climate change and health measures. But what do we need to do practically? What actions? The first thing that we need to do is one, inclusion of health in the national determined contribution. What is the national determined contribution? These are usually defined thematic areas by in-country, they call them the national designated authority. So the government of the day in every country define what is their climate priorities for focus. So this helps them to also streamline interventions, streamline financing, and also streamline workforce. And usually, what is not included in the NDC does not get optimal attention. And in the longest time, health has been one of those areas excluded from the NDCs, primarily because the thoughts around climate change evolved from the environmental perspective through the agricultural perspective. Our health is still struggling to gain a significant acceptance in that matrix. But as I will always say, health is the face of climate change, because whether you look at climate change from the environmental impact or you look at climate change from its impact on agriculture, the ultimate recipient of the overarching negative impact is the human person. And it's usually translated into either a better health and nutritional score or a negative health and poor nutritional score. So it's important that the health measures become significantly integrated into climate discussions at all levels, whether you're looking at the community, you're looking at the regions, or you're looking at the national government, regional frameworks, or continental or global framework. And that's why we've been working to see that this is appropriately situated, even in COPs meetings. Now, the second one is we need a capacitated health workforce that understands the interlinkages between climate change and health, and then are able to appropriately contextualize it into their health programming, health budget, and health implementation framework. Without that, then we're nowhere, actually. So we want to be able to build capacity for ministries of health using a One Health approach in such a way that they are able to work in a more coordinated manner with other sectors that also play significant roles. So we need health workforce in the ministries to understand climate change, linkages, and to be able to monitor and evaluate climate health policies so that that will also drive action. The third one is a multisectoral coordination. We know that the climate change issues do not sit in one sector, and we cannot continue to work in silos and expect optimal impact. So something we need to do is that even as we're in this webinar, we need to begin to articulate how do we better work with the animal health sector, knowing that many of the emerging and re-emerging infectious diseases are of animal origin. And you will know that climate change is exacerbating that interaction. Climate change is also creating an ambient environment for some of these zoonotic diseases to become more virulent, or to be able to now have more enhanced multi-species transmission. So we need to bring them. We need to bring the environmental people. The environmental health is a critical cause under environment. We need to bring them. How do we better work together to ensure a collective health for everyone? And that's where the One Health approach comes to fore. And we're saying that we need to have that kind of multi-sectoral coordination. International cooperation and advocacy. We should have advocacy briefs that support our contextual realities. And that means that we should be able to speak as in unison instead of having disjointed communications. And that way we're able to attract better attention and also more financing than we would if we talk individually as a country. We also have a better negotiating power talking as Africa than when we talk as Nigeria, Cote d'Ivoire, or Djibouti. Okay, and this is because as collectively we will form a larger bloc, and because our contextual realities are very similar, it is easier to enhance our discussions, especially as we're looking at the issues of climate justice and all of those. So that's a critical thing to highlight. And then, of course, the last one is domesticating this strategy, and I would highlight how we're already translating these policies to action towards the end of my slide. The second thing I'm going to talk about is capacity building. And I think all the presenters have recognized the place of capacity building in resilient health system, especially at the climate change and health measures. But how do we do this? How do we turn it from, yes, that understanding to policy? A lot of times we say trainings are overrated, but we cannot also exclude training because it is critical to build resilient health system, both for now and for the next generation. We see that in many climes, you see high turnover of staff, and people retire, new persons come on board. Training is a continuum, and we need to be able to do that. But for us to be able to do that, we need to do it in a strategic way that we have a significant pool that will help us to work our priorities right. The first one, of course, is enhancing health professional capacities. So here we're looking at already employed health workers who do not have a very good grasp of this climate change and health linkages. How do we have in-service training curriculum that speaks to what health workers should do, that is very tailored and specific in that context? That's a critical thing we need to consider. Now we talk of training of trainers. How do we build a mass of trainers across each of the member states? You will agree with me, some of my colleagues have alluded to this, that we need to go beyond national level to sub-national and sub-regional level. How do we build a pool of trainers that can lead climate health education at these levels to be able to orient people at health facility levels. We've talked about vulnerability and adaptation assessment, and I'm happy Dr. Tatiana talked about it significantly. This is a must for every country that wants to build a resilient system. You cannot create solutions for the problems that you do not know exist. And V&A is actually a matrix or a process by which you are able to identify what your challenges are, what the gaps are, what the opportunities are, what the threats are, and so that you can now be able to work forward to develop a health national adaptation plan. Now, these two areas are areas that also require significant capacity to undertake. And we need to be able to also make it in such a way that not just people at the national have this capacity, but people at subnational level can do a sectorial or limited geographical V&A based on their context of coverage, and then be able to develop appropriate mitigation and adaptation action that speaks to regional or district level health national adaptation plan. But of course, all of those will feed off to the national adaptation plan, as most of these things are always linked. The third one is to have a center of excellence. There are, of course, many other institutions that are already incorporating climate change and health as critical curriculums in their knowledge development metrics. Dr. Tatiana talked about the FELTIP in Mozambique and also talked about the inclusion in school curriculums in the university. So one of the things we need to do is to develop a standard framework, do a mapping, and get designated centers of excellence that we can actually facilitate peer learning opportunities and exchange programs with. And the last one is, of course, establishing a pool of climate health experts that we're already working on. The next thing I'm going to talk about actually is risk communication and community engagement. Many times, not everybody is a communicator, but the truth is that all of us in public health space or virtually needs to communicate, you know, and communication is a critical skill, whether you're looking at it at home, in the community, in your village meeting, or you're looking at it from a professional angle. You need to communicate in such a way that the recipients of your communication are able to contextualize your intentions and understand your communication based on the intentions of what you need to pass across. And to do this, communication must be strategic, communication must be appropriately channeled, communication must be such that the audience are well profiled to be able to enhance their understanding and uptake of the information that is shared. So one of the things we hope we're trying to do in terms of translating this policy to action is to develop communication strategy that is clear and specific on the different component areas of climate change. Then we also plan to have a climate and health week institutionalized in the continent, where we create opportunity for the media to be able to share this kind of contextual information. Then another one, of course, social accountability and advocacy campaigns. You know, we need to, many times we communicate forward, but we do not usually communicate backward. We're not able to receive, we communicate to the communities, but we don't allow them to communicate back to us. And you need to start co-creating some of these interventions that we want communities to adhere to. Some of us have highlighted behavioral change communication, but you want to also do that behavioral change from just your context without hearing the community. So we need to begin to step up such that we can co-create communication and have community inputs. And then the last one is ensuring that communication speaks to the right people and that the communication intentions are optimized through effective monitoring and evaluation of communication efforts to see what is giving you the greatest audience, what is also giving you the greatest audience perception, you know, in terms of changing what you want to communicate. The next one we need to talk about is, of course, science. Okay, yeah, so we need to talk about research, climate, of course, research and data generation. One of the things I've noted in Africa, across many domains, we have paucity of data. It's either we have it or we do have the data, but we're not sharing it through appropriate channels. You know, maybe again, because the quality might not be what might help us to inform action. But we need to begin to generate our own climate data. Recently, I was facilitating a presentation and I was looking at climate change and mental health. And I was looking at a review that was done for almost 10 years, you know, with over 3,000 publications looked at. And do you know what? We had zero information, zero from Africa. Like, and yet we see many people, from our own mindset, especially in our setting, we only think of mental health issues when people are on the streets, removing their clothes or taking trash. But mental health issues are real. When people are displaced by floods, they do not only suffer the consequences of infectious disease, they sometimes suffer mental health issues that are even more impactful than those physical illnesses that we talk about. So we need to begin to have our own data collection and monitoring system that looks at the intersectionality between meteorological information and epidemiological data. We need to have innovation in climate health tools. I think I really appreciate what Mozambique is doing in terms of the climate observatory and how that is linking with epidemiological information to inform enhanced intelligent early warning and response systems. We need to begin to scale up these innovations to other countries that are very prone. Community-based participatory research, like I talked about it, we need to begin to do participatory epidemiology. We need to be able to there are many indigenous ways that communities have tried to adapt to climate change. We need to test run some of these indigenous knowledge and see how we can refine it. Kutin talked about innovations. Many times we look at innovations as external and we look at it as copying what is in the global West. No, we need to also look at our indigenous knowledge and see how we can innovate around them and make them more adaptable to our current realities. Research partnership and data sharing. We need to begin to look at our various strengths. Those of us that are in the academia, look at partnerships that can give you the greatest results. Let's look at things that are very solution-oriented with the public in mind. Many of us do public health research, but the contextual reality of those research are not public. They are actually more of academic excellence, but we need to begin to look at how do we solve real-time problems, and that is where the greatest gain will be in research. And then we need to be able to see how do this research relate to decision-making. In October, we're going to be having a Pan-African conference on environment, climate change, and health from science to policy here in Nairobi. And it's going to be a continental meeting. And I'm using this opportunity to say we should look forward to read the adverts. The abstract submission is currently ongoing. Please look for it and come and share what you're doing in your area. But lastly, I will not end this presentation without talking about digitizing health data. That is critical. And then we also need to talk about funding mechanisms. We've already talked about the fact that fundings are getting constrained and we do not have as much resources as we used to have yesteryears. So it's critical that we begin to look at what are the innovative ways for us to get funding. I will refer us to an Africa CDC document called Africa Health Financing in the New Era. It did make some recommendations on how countries can better innovate around sustainable financing. That can be something we need to look at. So let's look at innovative financing models, continental climate funding mechanisms, leveraging existing funding mechanisms. I'm happy Tatiana talked about the Green Climate Fund, which is very cumbersome, but Africa CDC is also trying to support about 7 member states to see how we can access that fund and be able to use it for building resilient health systems and communities. Now, how do we get resources for capacity building on climate-related issues? Then there's one opportunity that has not been fully optimized in our continent, and that's the public-private partnerships, okay, and collaboration. Let's look at those and then also enhance our health budgets in terms of inclusion of climate-related interventions in the budgets. Lastly, I'm going to look at emergency preparedness and response, and of course, how climate change impacts on this. We need to build climate resilient health systems. And to be able to do that, it means that we must be intentional about climate change. When we are building health facilities, do we take the climate change component or climate angle to the health facility? Do we build it in such a way that it is resilient to major climate change impacts within our climate? Then environmental health surveillance, we need to take it a notch higher. We do know that for polio transmission, a lot of environmental surveillance was very key to helping us map the movement of the different polio types, and it has helped in response. So let's begin to enhance capacities in environmental surveillance. Of course, capacity building for emergency response. I'm happy that that is already being incorporated into FELTIP. We're already talking to AFINET and other FELTIP implementers to look at how we can put a module or two on climate change and health-related events. You cannot talk of enhanced early warning and response system if you do not incorporate climate intelligence. And that is critically important, that we're able to harness meteorological information and use it to inform our EWAS. And then community level disaster preparedness, multisectoral coordination is something we have highlighted earlier. So that brings me to some of the key next steps that we're undertaking at Africa CDC. So you see, we launched the Continental Framework just barely 2 weeks back. And some of the things we've thought to do post the launch is to, one, facilitate regional and national dissemination and adaptation, which we've already strategically commenced across various fora, and a few. Then the second is mobilization of resources and strengthen partnership for priority activities. At that launch, we did have significant global and continental partners attend, and they were highly impressed by the strategic direction. And we're hoping to leverage that perspective to see how we can further strengthen the implementation of the strategic framework. Also to highlight strengthening advocacy and stakeholder engagement in implementation. So one way again to move from policy to action is to adequately engage stakeholders. In engaging stakeholders and doing advocacy, we must be able to see how we can contextualize our frameworks and our activities in the language of the stakeholder you're talking to. If you're talking to the National Assembly, tell them how support for climate change intervention can increase their political value, because that is the language you understand. And and if you're talking to an entrepreneur, tell them how after their investment, just one flooding can cause a wash. So if they support this intervention, it's also going to be ultimately beneficial for them in the long run. Then accountability, we also developed a robust monitoring, evaluation, and learning, which we hope to use to optimize that framework. In the next 2 minutes, I'm just going to highlight some of the critical initiatives we've taken to translate the policy framework from this strategic document to pure action. The first one is, so we're looking at practical example of translation efforts in line with my topic. The first one is on leadership and coordination. And just last week, I was in Malawi, where we had a meeting of the Regional Ministerial Steering Committee of the Southern African region. That meeting brought 10 member states, the ministers across these countries, to a discussion. And one of the key discussions is how to move policy to action in line with my discussion. And we were actually looking at building resilience, saving lives, and the topic was actually mitigating the devastating impact of climate change on health in the lens of Harare Declaration on Climate Change. Last year at the Climate and Health African Conference, which the president of Zimbabwe actually opened, we had critical discussion on how to be able to ensure that research speaks to policy and that policy evolves into action. And those declarations was what we further discussed at this meeting. During this meeting, we were able to disseminate the strategy. We were able to talk to them about it. And one of the two things that came out of that was very, very useful for us was, one, the ministers committed to pushing for the inclusion of health in the national designated contribution, which I had highlighted earlier as one of our policy framework. The second one is that they made the Honorable Minister of Health for Zambia and Zimbabwe as a champion of climate change and health in the region. And the third one is that they also looked at how to enhance partnership and innovative financing model to be able to build resilient health security across the region. So you can see that this policy is already being translated, and we did have panel sessions, we had plenary sessions that allowed us to enhance this discussion. The second one I'm going to showcase is on capacity building. We've actually started what we've talked about, capacity building. Post the launch, we've had a capacity building initiative in Zambia. And in that capacity building initiative, we did not just train national level health workers, but we trained sub-national level health workers. And in the spirit of this strategic framework, you can see that the 40 participants that were trained included both regional representatives, but much more importantly, it used the One Health approach, ensuring that environmental health officers were trained, surveillance officers were trained, WASH officers were trained, and where they had specifically climate change and health officers, we also brought them at the regional level. And we did same for both the Ministry of Health Zambia, the Zambia National Public Health Institute, and also the National Designated Authority for Zambia. And it's good to note that we have a very robust curriculum that we've developed that incorporates 11 thematic sessions cutting across the most areas, thematic focus of climate change and health, including climate change interactions with mental health. And we try to make that training as participatory as possible. Just to give you a highlight of the Zambian training, we did an evaluation, and we found out that after the training, we had almost a 30% increment in knowledge. And when we tested this knowledge change using the student peer sample test, we found out that this was a significant change. And that was something to show you that capacity building was and is necessary for us to continue. Now, we also try to get the feedback of the participants so that we can actually enhance that training model. And it's instrumental to note that the feedback shows that the training was significantly relevant, the engagement was highly optimized. Even the participants felt that they had improved significantly based on their own reflection, and all of them committed to using the knowledge that came from that training to inform further actions. And we asked them how specifically would you use this knowledge. Some of them said that they are going to now orient their staff. Some said they were going to use it for planning and implementation of adaptation measures at the health facilities, but also at their districts. Some others said that they are going to work locally to develop health national adaptation plan that speaks to their different provinces and districts, while another highlighted the fact that they were going to use it to create awareness in both the health sector and communities. And when we asked them how would they do it in communities, they said they were going to leverage already established community health workforce that they have. So I want to thank you very much for your attention. I'm sorry if I shot over the time significant. Thank you, and over to you, moderators.
Thank you very much, Dr. Charles, for that enlightening presentation. You've clearly laid out how policy can be turned into real actions. So right now, we'll be moving on to our final speaker for today. And before that, I would like to sincerely apologize to all our participants for the time. The webinar is supposed to last for 2 hours, but unfortunately, we've exceeded that, and we are still going to take more time. But we promise you that in the next few minutes, we're going to round up. And the questions and answers, please post your questions in the question and answer box. It will be responded to by the speakers. We won't be having a question and answer session after this. So thank you very much once again. And quickly, I would like to do a brief introduction of Dr. Sushi so we can have a background knowledge about her. So she is an associate professor of public health dentistry at Volkagura Sangha Dental College and Hospital in Bengaluru, where she integrates climate change, oral health, and life skill education into public health practice. With a PhD in public health dentistry and a postgraduate certificate in climate change, Dr. Susie brings a multidisciplinary lens to our work, focusing on health system strengthening and climate resilience. She has led and contributed to several national and international initiatives, including collaborations with the WHO Southeast Asia region and the Global Climate and Health Alliance. As a fellow of the India Health Policy and System Research Program and founding faculty lead of our institution's preliminary Health Students Club, she is committed to empowering health professionals through climate health education. Her leadership and advocacy continue to shape innovative responses to public health and environmental challenges in India and beyond. We would like to note that the Zoom session will close at exactly 2:30, so we will ensure that the remaining sessions we have will be very short in order to ensure that we are still in time. Thank you very much. You now have the floor, ma'am. Thank you for your time and your patience.
Thank you, Faith. Am I audible or am I visible to everyone?
Yes, you are
Yes.
audible and you are
Okay.
visible.
Thank you. Thank you for your introduction. And it was great listening to all the speakers. A lot of learning opportunity for myself personally as well. So let me share my screen. So are you able to see my screen?
Yes, we can.
Okay. All right. So since there's already a delay, I am going to straight away jump into my presentation. So we have all listened and heard, and we have deliberated on the effects of climate change on health, and so I'm not going to touch upon those descriptions. So I'm going to focus more on how can we integrate the concept of One Health into the existing health systems so that we can strengthen the health systems to become more climate resilient. And it is the agenda of my presentation goes through understanding the One Health approach as such and how it becomes imperative for health systems to become more resilient to climate change. And how can we achieve the synergies between One Health climate resilient health systems, and what are the strategies for integrating this concept of One Health into the existing health systems. And finally, I will conclude by discussing a little bit about challenges and mitigation strategies. So as we all know, extreme weather events and many of the pathways of climate change, they directly threaten not only just the human health, but also the animal and the environmental health. So sometimes we are so much focused on protecting human health that we forget that the other living beings and the other non-living beings in our planet Earth are getting affected by the human activities. And if we do not protect these other than human species, we cannot protect human health. So it is as simple as that. And that is why when there are climate shocks or climate emergencies, health systems are we suppose that the health systems should be able to absorb these climate shocks. And because there are interconnected risks because of this zoonotic spillover or vector-borne diseases, and because of the ecosystem degradation, it's inevitable that health systems are integrated with this concept of One Health, because it recognizes not just humans, but it recognizes the other living beings. Therefore, One Health can give us a roadmap to build resilient health systems capable of withstanding climate shocks. We will see how this is going to be important for us. Since we are talking about One Health in this lecture, we have been hearing about the usage of this frame and the policies which have tried to adopt this as a concept in G7 and G20 leaderships, and it has been explicitly referred in ministerial declarations. But however, though these leaderships have been very slow in knitting the One Health approach into the larger systems approach, because we cannot think of One Health as a siloed approach. It has to be incorporated using systems approach. And that means we have to understand the complexity in which the health systems exist and work. And therefore, health system resilience is one of the key features if we have to be ready for pandemic preparedness. So if you look at how One Health is defined also, if you see that it involves three important principles. That is, it has to work in a collaborative mode, it should be multisectorial, and it should draw knowledge from transdisciplinary areas. So once we have these set of unified or holistic system of knowledge and working in collaborative multisectoral scenario, it should be able to operate at local levels, national level, regional level, and at global levels. So that is basically what One Health does, is it breaks the disciplinary barriers and it enables us to foster a holistic surveillance system, because we are communicating parallelly with different stakeholders and experts. We are coordinating with them, and there should be data sharing among all of these stakeholders like public health professionals, veterinarians, ecologists, policymakers, and definitely communities with whom we need to co-create solutions. Instead of picturing health systems as or health governance as an apex body sitting and directing solutions, a more holistic systems thinking approach is required if we need to incorporate the concept of One Health. Therefore, WHO also defines this approach not only in just keeping those concepts of collaborating, but in designing and implementing programs, policies, legislation, and research in which multiple sectors can communicate and work together. So the approach extends beyond outbreak response, which is what most of the health systems are equipped now. So when there is an outbreak, we react to it. So the health systems right now are more reactionary rather than anticipatory. And that is the goal of One Health integration into health system. The goal is to transform the health systems from reactive to anticipatory, so that we can incorporate antimicrobial stewardship, food safety, wildlife conservation, and ecosystem management, all of which influence climate-sensitive health outcomes. And we need to have One Health embedded into policy so that it enhances their health system's capacity to adapt to a changing climate. So with this background, it becomes very imperative for us that we bring in resilience into health systems, because the climate-driven disruptions directly affect the health system vulnerability. We all know, and previous speakers have very eloquently described it with examples, how these different climate disruptions like heat waves, flooding, droughts, and shifting disease vectors result in water shortages, power outages, increased patient loads during extreme events. It all leads to interrupted care in our health systems. It leads to supply chain breakdowns. And health systems become so overwhelmed that even surveillance operations cannot take that kind of a load, because it makes the health system more vulnerable, because they're not built to absorb the shock, or they're not built to be prepared for the future health events, climate events. So resilient health systems basically mean that we anticipate. The health systems should not just be able to react to a particular climate health emergency, but it should be able to anticipate and absorb climate shocks. How can we do that? Only through adaptive infrastructure, flexible financing, and community partnerships. We should be able to do that. And once we integrate One Health principles, it ensures this kind of resilient quality into these health systems, because we are not only just working within the health system, we are going beyond that and addressing some of the examples, like, for example, what are the policies regarding land use change? What are the policies regarding livestock practices? All of these have direct implications on disease risks under climate stress. So health systems cannot work in silo alone, but One Health will allow the health systems to interact with other sectors, which have under climate stress can impact health outcomes. So that is why it is very, very important to take the benefits from synergies between One Health and climate resilience. So there is no blueprint for health system strengthening, because it needs to be contextualized in the local realities and adapted to the local needs. But we can have a broader framework for integrating One Health. And how does it integrating this helps build resilience into the health system is basically promoting unified surveillance networks, because we track climate sensitive diseases not just in humans but in animals. So as the previous speaker was telling, we will be able to anticipate if there are already established data sharing with the veterinarian health systems. The health systems for the humans would be able to anticipate and prepare itself for providing its health services. And secondly, it informs land use and agricultural policies. These are extremely important, which requires us to collaborate with ministries of agriculture and land uses to reduce habitat fragmentation. We all know that the urban development and the rural developments have direct impact on habitat fragmentation and zoonotic spillover. So it's important that One Health enables us to look at these things. Thirdly, when we strengthen the ecosystem services such as wetlands for flood control, it buffers the climate impacts. And we can engage communities in participatory monitoring, because people are the ones they are the victims of these climate shocks, and they are living in that particular local climatic conditions, and they should be involved in participatory monitoring of the environmental and health indicators. And when the local governance works in collaboration with such community organizations, that is what One Health actually motivates us to do. In future slides, I will share one of the examples of the community organizations, how they are working, taking the key elements of engaging communities, which is one of the key elements of One Health. And finally, it aligns all these different sectors, basically veterinary, environmental, and public health resource planning for rapid response. So integrating One Health by this collaborative, multisectoral, and transdisciplinary approach enhances the resilience. And it does so because it has some pillars which we can use as strategic pillars for integration. Firstly, what we can one of the main pillars we can use is cross-sectoral governance, where we can establish interministerial committees that bring together health, agriculture, environment, and disaster management authorities together to sit and share the knowledge and resources and plans, define shared mandates, data sharing protocols, and joint budget allocations to operationalize One Health resilience plans. And second pillar of strategy pillar could be surveillance and early warning. When we develop integrated data platforms that link human clinical reporting as well as veterinary case data and environmental indicators, for example, precipitation and temperature anomalies, it helps us to have predictive analytics to forecast outbreaks and mobilize resource preemptively. So beforehand, we are prepared for it. That is the second pillar. The third pillar is definitely community engagement and education, because we all know that though climate change now is discussed everywhere in many of the conferences and summits and intergovernmental panel discussions, but even today for common people, climate change is not perceived as an existential risk. So we think that maybe in future, in some other timeline in future, it is going to come to affect us. But it is not so, and we are already seeing the effects in the present. And if we just look at the number of hours we are left with, I mean, in our entire career of the human life, of one individual's human lifespan, around 80,000 hours are there to just work on something which is really contributing to the society. So it is extremely important to include the community and engage them in co-creating solutions, because when we co-create risk communication strategies with local stakeholders like farmers and indigenous groups, it builds trust and improves reporting of animal illnesses or environmental degradation. When we educate communities on adaptive behaviors such as safe livestock handling during floods, it reduces disease transmission. So as an example to this strategy, I would like to share with you all one example of a village in Kerala state in India. It's called Edakochi. And this is a place which has been affected by salt intrusion due to the land encroachment by flooding. So they have created Edakochi Janakiya Samiti, which is their community organization. It's a proactive community engagement for local solutions and tidal flood awareness. So it creates societal awareness about recurring challenges posed by tidal flooding and seeking sustainable solutions. Mainly, this organization has been working on creating tidal awareness among the villagers, the farmers, and the fishermen. And it focuses on coastal protection advocacy. So it advocates the coastline advocacy through demonstrations and mobilizing people to demand for their rights with the local governance. It also promotes sustainable agriculture. Now that the modern agriculture also may not be suitable for the present climatic situations there, so they are promoting a form of agriculture called pokali cultivation in the Chettinapad paddy fields, which is a traditional farming practice well suited to the local ecosystem. And they have a civic accountability and project tracking because they want to have a very transparent system where people can come and see what the organization is doing. It's basically the organization is made up of people who are affected by this in their place. So there is a lot of grassroots support by the farmers and the livelihoods who have been affected by the saltwater intrusion there. They document whatever they're doing, and they do the knowledge sharing by having a digital presence, by systematically archiving the data and open data for research. So they have done, just I'm sharing one glimpse of a recent survey which was done on water and health in a small village, where they saw that the health issues are coming up which were not there earlier, such as dengue and malaria. These places were never affected by this, but 11.5% of them have reported dengue and malaria, 28.8% reported diarrhea, 21.2% reported skin diseases. So this is how a community organization which mobilizes people who are already affected and experiencing, and they've lost their livelihoods, or trying to they are trying hard in order to interact with the existing local governance and the health systems by providing co-created solutions. And since I come from a teaching hospital background, what I was able to do at student community level was to bring awareness among the students who are the future healthcare professionals, so that they are aware of what are the climate change and climate risks scenarios by establishing a students club. So it's called Planetary Health Student Club because it is rooted in the concept of One Health, so that the students are made aware, and through the students' movement within our campus, we are able to bring in awareness among the other healthcare specialists and faculty, and the young students now are well equipped to practice in future with this concept, and it creates critical thinking, it stimulates creative thinking among them. And this we bring out a magazine which where the students can contribute different articles and different activities where we try to educate in campus and engage with our outreach programs of the institution, where we interact with different target groups such as schools and villages and peri-urban areas, where we also try to bring in awareness of the intersection of health and climate change. So the third pillar to integrate One Health is by building capacity among the workforce, which all the previous speakers have emphasized upon. So it's very, very important to design interdisciplinary training programs for health workers, veterinarians, ecologists, and emergency responders. So basically what happens is we always focus on capacity building, focusing on healthcare workers. But if we incorporate One Health, then we will not leave out the other important stakeholders like veterinarians, ecologists, and emergency responders. So if we are integrating One Health in our capacity building training programs, then our target group will consist of experts from these different areas instead of a homogeneous health workforce. It should be emphasizing on climate science literacy, field epidemiology, and ecosystem health to foster collaborative problem solving during climate events. So just to share some of our examples, we were part of the Indian Institute of Science, Devacha Center for Climate Change, where we are organizing national level training program for healthcare professionals on creating awareness to them about health in the changing climate. And so many of our students took part in this. It was not just limited to health professionals. Many people from technical backgrounds and from artificial
Hello, Dr.
intelligence
Susie.
background. Yes.
So sorry, the webinar will end in 3 minutes. Is it possible we...
Okay.
Yeah, thank you.
Yeah, sure. So where different stakeholders came together and created certain, discussed about certain solutions. So we do that, we get it back into the campus and we create panel discussions and we do community engagement programs. We present that at the annual Planetary Health Summit, which happened in Malaysia. We also contributed to case study in Lancet. So there are different ways in which we are engaging. And the fifth strategy is resource mobilization and financing, where we leverage climate adaptation funds, global health security grants, and public-private partnerships to invest in joint surveillance, emergency stockpiles, and ecosystem restoration projects. So it's basically helps us to implement risk pooling mechanisms that protect budgets against climate-related budget shocks. So these are some of the strategies, but there are some challenges, like when we have existing fragmented budgets. So that is the challenge in front of us. How do we advocate for unified budget lines and demonstrate cost effectiveness for integrated interventions? The other challenge is that most of the data are present in isolations, and they work in incompatible information systems. We have to mitigate by adopting digital platforms which can share this data. So in order, so just to conclude my presentation, I would say that building climate resilient health systems demands a paradigm shift from sectoral responses to a unified One Health strategy. That can be done by fostering cross-sector governance, integrated surveillance, innovative financing, and these things can help our health systems to adapt to climate shocks. Enhancing One Health not only mitigates immediate risks, but it also safeguards the interconnected fabric of human, animal, and environmental health for future generations. So I thank you for advancing One Health and participating in this discussion from my side. Thank you.
Thank you very much, Dr. Sushi. We sincerely apologize for the time. So we have come to the end of the webinar today. Thank you, everyone. Thank you for joining. Bye, and see you next time. Bye.